Morning, everybody. We're here to talk about secondary infertility. This was brought to our attention. One of my nurses was in contact with one of our patients who's been suffering from secondary infertility for a very long time. There was a recent article in the Washington Post about this very thing called secondary infertility, which in reality, the definition of secondary infertility is the fact that somebody is suffering from infertility but has been pregnant before, whether that pregnancy, that prior pregnancy was either a live birth, preterm delivery, a miscarriage, or an elective termination. Now, unfortunately, we are seeing more and more of secondary infertility these days. It accounts for about 3 million cases of women seeking care with an infertility specialist in the United States today. So roughly about half, but that number has been creeping up year by year. We think that the main reason for this is age-related factors. As we get older, age plays a bigger role in a woman and a male's chances for being able to conceive. Oftentimes, and we see it way too much here in our office, is that patients conceive for the first time, they have a child, and then they get lulled into a false sense of security, thinking, oh, I must be really fertile and I should have no problem trying to conceive next time, and I'll have the same success that I did the first time, whether it's untreated or treated. It's something that we have conversations about with our patients all the time, and we tell them to please consider the fact that most couples want more than one child, and to not take anything for granted. In terms of the causes of secondary infertility, as I said, the main one is age-related, but certainly all of the other ones that cause primary infertility are in play here, whether it's a male factor or any of the other numerous causes that affect women: endometriosis, pelvic anatomy issues, whether it's tubal obstruction or pelvic adhesions as a result of previous surgery, endometriosis, or any sexually transmitted disease. Nowadays, we are being more proactive in trying to address the issues that can come up with infertility in general. But primarily, when we focus on infertility, we think about not only the present but the future as well. Anecdotally, we have patients all the time now who are beyond the age of 35 and come to me with, for example, primary infertility, having never been pregnant before, perhaps being in a new relationship, and they are thinking not only about trying to conceive when they're having difficulty, but about the problems that they could potentially encounter once they're ready to be pregnant again. Around here, we call it the Xyz Theorem. So X is the amount of time it takes either the couple or us to help them conceive, which is unpredictable. Y, which is the 9 months of pregnancy, and then Z, also unpredictable, is how much time it's going to take a patient to be ready to be pregnant again. And that could have far-reaching implications on that couple's ability to conceive. So we try to mitigate those difficulties by proactively trying to, for example, freezing embryos. Today we do what's called embryo batching, which is becoming very common in our world today. For example, I have a patient who was 39 years old, incredibly intelligent, very educated, comes from a big family, so does her husband. Literally came to my office with the idea that they wanted to do what's called embryo batching, which is subject themselves to several cycles of in vitro fertilization with the purpose of being able to freeze a surplus of embryos, not only for the present, but also for future use. I believe that she had 4 siblings, he had 5, so they had always dreamed of having a large family themselves. And this is really the only way that we can freeze a patient and a couple's fertility in time. Advanced maternal age is also becoming a big issue with secondary infertility. Men incorrectly believe that they're fertile to the day they die. And while there is some truth, definitely some truth to that, we know that the quality of sperm diminishes with time. Certainly, after the age of 45, it's considered an advanced maternal age. Women are considered after the age of 35 advanced maternal age because of the increase in what's called the aneuploidy rate. Aneuploidy is a abnormality of the chromosomal makeup of any one particular egg. Well, the same phenomena occurs in men. While men are still making sperm exactly till the day they die, the quality of that sperm, particularly in the DNA machinery that helps sperm mature, becomes faulty or defective. And so we see a higher incidence of cognitive delays in children born from an advanced maternal age men. We see a higher rate of autism than we do in men who are fathering children below the age of 45. So definitively something to consider, and we've been talking about all the ways that we can mitigate these things from happening. One thing that we're seeing also very frequently is men freezing sperm. They're freezing sperm prior to a vasectomy, for example. It's become very common now, second marriages, where a man has had children in his previous marriage or relationship, and meets somebody else who perhaps doesn't have children. Now they've had a vasectomy, and rather than having to undergo the procedures necessary to extract sperm, basically, from the testicle, now they're freezing several vials of sperm for the possibility of needing to use the sperm in a future relationship. So all the things, I think couples are becoming more savvy. They're becoming more aware about their fertility. Fertility is becoming more important because we as a society have elected to postpone our fertility for a later time, either to achieve professional pursuits or just personal issues, meaning not ready to be a parent yet. And I can totally understand that as well. But because the biology does not cooperate with us in our decisions to postpone conceiving, we need to take the appropriate measures to prevent difficulties in the future. I want to thank you for joining me today. It's really a pleasure. I think it's a very important topic that we've been discussing. I think it's become more and more common in today's world, and I'm glad I had an opportunity to share that with you and give you a little bit of knowledge to take home. Thanks so much. Bye-bye.